Good day. I want to begin today by thanking all the people that keep the ball moving. All the workers that you don't see out there creating some sense of normalcy for all of us. Whether you're stocking a shelf or delivering a package or just cleaning a site to make it ready for tomorrow, thank you, all of you, for all that you're doing to keep us safe and to keep the islands running. The hundreds of people that do all the little things to keep our society running, thank you, thank you, thank you. I also want to thank each of you who took the time today, this afternoon, for a little bit, for a moment of prayer, fasting, and reflection. I know that the spread of this virus and the disruption to our everyday lives has caused a lot of stress and anxiety. And we wanted to have the territory just to take a moment to unite in a call for supplication and to remember that there is hope. There is hope out there. To date, we have tested 180 individuals for the COVID-19 virus in the territory. 126 of those came back negative. 30 of those tested positive, and we still have 24 tests pending as of this morning. As the number of cases in the territory continues to slowly increase, I think it is important to point out that as of today, 19 of the 30 individuals that have tested positive thus far have made a full recovery. This means that currently we have about 11 documented active cases and performing the necessary contact tracing on those individuals. So although we continue to update the public on new cases, we are pleased to point out that the folks who were initially infected have recovered and are doing quite well. I also want to remark that of those people, no one has had to be detained in a hospital for any extended stay. Again, I cannot stress enough how serious a situation this is. Just yesterday, the nation's top expert of infectious diseases projected that between 100 and 200,000 people could die from COVID-19 in the US alone, with millions more becoming infected with the virus. We have been fortunate, but we have been vigilant this far, but don't be lulled into a false sense of security that we will be exempt from this virus. We will not be exempted from this count. We will not be exempted from the perils of this virus that are to come. Like we have been saying, we learn something every day about this virus and how it is spread. The White House has announced yesterday that they are extending the social distancing guidelines to April 30th. This means that we too will be changing our strategy in flattening the curve. As a result of the announcement by the White House, the state of emergency will be renewed for another 30 days and will extend the stay-at-home order and the closure of non-essential businesses at least until April 30th. We are further extending the closures to all food and entertainment establishments, including restaurants, bars, and food trucks, from operation on the beaches. I want to make this clear. I'm going to say it again. We are extending the closure to all food, entertainment, restaurants on the beach. We have seen quite a curtailed amount of people with beach activity, but there are still establishments that are operating on the beach that are causing people to congregate and such. Those are closed effective immediately. We are still noticing the congregation of people outside some convenience stores and gas stations. Let me warn you, or promise you, any establishment found in violation of this statute will be subject to closure until April 30th and/or permanent revocation of said business license. This is not a joke. We are taking this very seriously. We are wasting valuable resources in sending our officers out there to curtail this type of activity. If we catch you, we're going to shut you down. take this seriously. For the most part, we have done good as a community in following the Department of Health and CDC guidance to help contain the spread of the virus. But we still have some in our community who are not taking this seriously. If you have any doubt of the seriousness of what we're dealing with, just tune into any one of your favorite news channels and see the bodies being loaded into trailers, and maybe you will have a change of attitude in dealing with this very serious virus. Whether you're 8 or 80, this is a peril to all of us, and each one of us has to take the precautions, even if we're not considering saving ourselves, but saving your loved ones and your family. During this crisis, we have tried to be as optimistic and at the same time as realistic as possible. We have acted preemptively to curtail movement and the spread of the virus, but we have to come to the reality that no matter what we do, we will have to deal with the spread of the virus just like every other place. We just want to ensure that the spread does not overwhelm our healthcare system as it has in places throughout the world, and that we protect the most vulnerable among us, our elderly, those with compromised immune systems, and people who cannot fight against this virus. We need each of you to do your part. Number one, by staying at home whenever and whenever possible. And number two, by assessing your individual situation and adjusting to this new way of life. It's gonna be a while before we get back to normal, but life must go on. As your government, we are making these adjustments by the minute, by the hour, by the second. We have already begun the preparations to issue the stimulus funds as soon as they become available from the Treasury. We estimate that this could be anywhere from $40 to $50 million into our territory, and a welcome relief to many in our community who have been deeply impacted by this pandemic. But this will not be enough. We have a long and treacherous road ahead. I have said it before and will continue to say that we are fighting this virus 2 disasters at a time. One on the healthcare front and one on the economic front. Ultimately, our success is up to the community. We have done our best to set the mandates that eliminates the means and the venues for the community spread. Now it's up to each and every one of us as to whether we comply with them or violate them, and come out of this thing as resilient and strong Virgin Islands we know ourselves to be. God bless you, and God bless the Virgin Islands. I will now turn you over to the Commissioner of Labor to give you some updates on what we're doing around unemployment, and we have the Commissioner of Health here to answer any questions that the press may have. Commissioner?
Good afternoon, Governor. Good afternoon, people of the Virgin Islands. I hope that all of us, our families and loved ones, are heeding the Governor's words and taking this very seriously during this unprecedented time. Even though we're in the midst of unparalleled challenges, it's very important to keep the lines of communication open and update everyone on what's going on as it pertains to the role of the Virgin Islands Department of Labor. The impact, the coronavirus or COVID-19 has put an end to the daily routines and operations of our lives as we know it. Vital is confronted with not only the health risks presented by the virus, but also the personal and economic disruptions caused by the strategy of having to fight to slow and end the spread of this virus, utilizing the outlined strategy of social distancing. The impact of this pandemic has triggered many establishments in our community to make the difficult decision to downsize, reduce hours, and/or to close altogether until further notice. As a reminder, the regular unemployment insurance program is for coverage when an individual has been laid off due to no fault of their own and have had reduced hours of less than 20 hours a week. Currently, for the week of March 27th, we received well over 1,000 applications for regular unemployment insurance. Again, this week, the majority coming from the St. Thomas St. John district. However, the St. Croix district is beginning to ramp up. Hence, we're having more individuals that need assistance coming to our locations, creating more traffic and causing longer lines that cannot meet the guidelines for social distancing. Therefore, the Virgin Islands Department of Labor has created a new process for filing unemployment insurance applications. One, we at Vital take the safety of our staff and community very seriously. Based on this need, we will, on Wednesday, April 1st, 2020, the Virgin Islands Department of Labor will no longer accept applications in person inside of either of our locations on St. Thomas or St. Croix. There will be drop-off boxes for unemployment insurance, as well as workers' compensation documents to be collected outside of each building. Please contact the Virgin Islands Department of Labor for further information at 773-1994 on St. Croix and 776-3700 on St. Thomas. The Unemployment Insurance Claims Handbook would also be available outside of each building. Second, beginning Wednesday, again April 1st, 2020, the Virgin Islands Department of Labor will only accept unemployment insurance applications submitted online. Yes, I'm happy to report that we have been able to establish an online process. The claims will be accepted electronically by using our website at www.vidol.gov, and the application can be submitted from a computer and or your mobile phone. If you have already dropped off your application form, you do not need to resubmit it online. Again, if you have already submitted your application form, you do not have to resubmit it online. 3, we understand that there has been and will continue to be an increased need to call us, especially for those that have challenges with the technology to complete the online application process. To address this, starting again Wednesday, April 1st, 2020, we will have a hotline to assist claimants and customers with questions and to complete the online application process. This will be staffed 24 hours a day. On the hotlines, claimants can get assistance with filling out their unemployment applications, as well as more information about the general process to file an unemployment insurance claim. 4, a Vital team member, or a member of the Virgin Islands Department of Labor, will contact you within 72 hours to confirm your online registration as has been received and provide the next steps. We anticipate that application will take 2 weeks for processing. Again, number 4, it's important to know that we, the staff of Vital, will contact you within 72 hours to confirm your online registration has been received and to provide the next steps. 5, to complete the process, all persons who apply for unemployment must register on www.vidol.org. To prevent any delays in processing your claim, please ensure that you retrieve your VIEWS, that is a Virgin Islands electronic workforce system, username before a Vital or Virgin Islands Department of Labor representative contacts you. The VIEWS system is the portal for all posted jobs in the territory. Your unemployment insurance application will not be finalized without this registration. Claimants must or can register online and receive a username in minutes. 6, very shortly, we will have 2 videos posted on YouTube that will help claimants with the unemployment insurance process. So again, it's very important that we are no longer accepting paper applications. The entire process is moving online, effective Wednesday, April 1st. Also, it's important, the governor mentioned the resources that we expect to come. Over the weekend, Governor Bryan and I signed an agreement with the U.S. Department of Labor agreeing to provide aid to the U.S. Virgin Islands residents via the CARES Act. This agreement includes agreeing to implement the following programs. 1, a pandemic unemployment assistance, which will be similar to the DUA or the disaster unemployment assistance. The emergency increase in unemployment compensation benefits, that's the federal portion. The number 3, the pandemic unemployment compensation. 4, temporary full federal funding of the first week of compensable regular unemployment for states with no waiting week. And 5, the pandemic emergency unemployment compensation. It's important to note that the CARES Act, and which encompasses these programs, we are not ready to implement them as yet. The funds and the guidance has not been released. As it pertains to the Family Medical Leave Act, it's very important. We've been getting a lot of calls. We are still awaiting the official guidance from the Wage and Hour Division on the family's first Coronavirus Response Act. However, we do know that there is going to be additional weeks that will be provided to assist employees who have been affected by COVID. The sick leave, the paid sick leave, again, will be issued to full-time and part-time employees who are directly affected by COVID for up to 80 hours at 100% of their pay. The legislation also provides for sick leave for 2/3 of an employee's pay if they are taking care of a quarantined person or care of school-age child whose school has been closed in response to COVID-19. It's important to note that to take advantage that this also takes effect April 1st. More information and guidance will be provided. As soon as we get it, we will distribute it as soon as it becomes available. Finally, I want to continue to adhere. I want us to continue to adhere to the guidelines from the Virgin Islands Department of Health, the governor's warnings, so that we can remain at home as much as possible and to protect us from this illness. Let's all be safe. Thank you.
Just a couple of housekeeping things before we go to questions. One is beaches. We've been keeping track. We've heard a lot of talk about beaches and beach closures. We've been patrolling the beaches for the weekend. For the most part, those beaches are empty, and when people go, they're sticking to themselves. We're asking people to try to stay off the beach. If you must go to the beach, stay away from other people, stay to your immediate family. Don't hold exercise classes. Do not have parties and picnics on the beaches. That's why we're closing these beach bars. We don't want people congregating. Restaurants, we didn't explicitly say it. We said for takeout only, but wherever possible, please call in your order. When we envisioned takeout, we didn't envision it that you would be going to the restaurants, sitting there and waiting for them to prepare your food. Just call ahead, give your order, and then come and pick it up when you think it's necessary. This is about keeping you safe, as well as the restaurant people. We want to keep them safe as well too, and our other people. Lastly, the first is Wednesday. It's the day when most SNAP recipients or food stamps go to the grocery store. We're asking people, if you don't absolutely have to go to the grocery store on that day, do not go. Even if you're a SNAP recipient, if you can delay your shopping to Thursday, Friday, or Saturday, that would be perfect. Or even stagger what time you go in there, so you go later in the day. That would be perfect. But to other people, please stay away from the grocery store on Wednesday, April 1st. I'll say it again. Please stay away from the grocery stores on Wednesday, April 1st. It's going to be packed anyway. It's not a good place to be in terms of curtailing the spread of this virus. We're asking that people stay away from the grocery store as much as possible on Wednesday. I will take some questions now from the press if there are any. Through this, we want to treat everyone like adults, so you need to act as an adult. If we see this weekend, we're still discussing it amongst the government house staff and the commissioners. If we see compliance with the beach, we won't have to close all the beaches for Easter. We're looking at that situation right now. We're thinking about 100% shutdown of all beaches. So please be discretionary in terms of the use of our beaches. No questions? One question. But bear with us, there's a 15-second delay between the phone service and our service. Thank you to all the pastors that participated today as well for the prayer vigil and the day of fasting, prayer, and reflection. One second while we fix a technical issue. You could relate a question. Repeat the question.
As we've been told, a number of individuals that have COVID-19 in the territory, we have, the disease of the virus itself takes about, 2 weeks to pass on a normal basis. Is there a way that we are keeping track of those who have overcome the virus? And is it still considered someone with the virus in that count if they have overcome it?
I can't hear the question. Repeat the question for me.
It's about overcoming. I can
Okay.
answer.
You can answer.
If I'm going to reiterate so that I can make sure that I heard everything, but you wanted to know whether or not we were keeping track of the positive patients as well as the ones that have overcome the virus. And so what we have in place right now is we have one person identified to call anyone who is COVID positive. They call them actually every day to check on their medical status. If things are changing, refer to a physician or emergency room if needed. That actually has provided a lot of support that also allows us to track the time in which they actually have recovered, and we're also tracking that as well.
Other questions? Go ahead. Go ahead.
Yes, John Marino, Reorg Research. The Senate passed legislation on Friday to authorize borrowing of up to $120 million for the government. It's kind of a two-step process. The first part would, your first option would be to borrow from government aid, public.
We lost him. The call dropped off. Other questions? If we can get, there we go. Go ask a question. Go ahead. The mic was open. Go ahead, ask your question.
Yes, I'm wondering if when you believe the government will need to borrow money. The Senate approved legislation on Friday authorizing up to $120 million for the government to borrow.
Yesterday, we would have need to borrow it. We just remember they have delayed now the tax filing deadline to July 15th, which greatly impedes upon our ability to expend dollars. One of the issues that we're fighting on two fronts now is the ability to be able to pay the stimulus checks because it's reimbursable, so we actually have to distribute.
I would like to know from the Department of Labor, with in reference to the CARE Act, when is the federal...
We have to disburse the checks first and then be reimbursed after the fact. I think we had another question. So we are already in talks with lending institutions. We've been so for the last 2 weeks on how that money would be dispersed and what forms of repayment would be applicable. But we have until May for it to before it becomes critical. We had another question about the Department of Labor.
What forms of repayment would be applicable, but
Next question. No other questions?
Hello, good afternoon. Luciba Knight over at the St. Craven. I would just like to ask, one, exactly which businesses were shut down as a result of not complying with your order? And then two, the hotels have had to stop taking in guests except for emergency workers. A quick search online a few days ago revealed that most of the Airbnbs and VRBO properties were still open for business within the 30-day blackout. And I'm just wondering what kind of enforcement the government can bring to enforce that shutdown order on vacation rentals. Thank you.
Well, two ways. The first way is that the airlines up to Friday had to get a pass for a physician who was in transit to the territory, where the airlines were telling them if the Virgin Islands is not accepting people who are staying in hotels or Airbnb, so you can't get on the plane. They're not letting you get on the plane. The other way we're working with Commissioner Bochelta to shut down the reservation systems for those Virgin Islands Airbnb places and Verbo and other forms of checking in there. But most of it, to be quite honest with you, is on good faith. We don't have the resources to go out there and check all of these institutions. We feel that it has been working. The main goal of this was not essentially to keep people out of hotels, but to keep people from flying to the Virgin Islands. So we have successfully curtailed that by a huge amount. Actually, American, I think, is down to one flight a day on both islands. Delta has canceled their flights into the territory. So we're seeing that shutdown of people coming into there. There are no hotel rooms available. The airlines and the carriers are not providing seats to a place that doesn't have hotel rooms. So far, so good in terms of that. And we think our goal there has been accomplished, even though checking every single Airbnb for guests on reservation would be a Herculean task, given our limited resources. There wasn't another part to that question.
Which businesses were closed?
Oh, which businesses were closed? We don't have any, I don't have any information on what specific businesses were closed. That's more of what's going to happen from going forward. We didn't have a closure order over the weekend, but now we're going to we continue to step it up a little bit. We're going to just permanently close down these businesses because it's the same violators over and over again. Other question? Now we're going to continue to step it up a little bit. We're going to just permanently close down these businesses because it's the same violators. You have a question?
Hello.
Go ahead.
Bryan USVI Consortium.
Go ahead, Ernest.
I'm not sure if you guys can hear me, but Governor, I want to ask for some clarity on our liquidity situation. I know you spoke of the stimulus monies for individual Americans and families that will be dispersed by the federal government. The local government, according to the Congresswoman, has to take care of that. I think you mentioned that it is a reimbursable program whereby the local government has to upfront the funds and then be reimbursed by the federal government. And there's also the issue of government liquidity as it relates to the regular operations of government, so payroll of government employees. I would like to understand what is the situation there. Are we able to do this comfortably? If not, how are we going to make sure that not only does government employees get paid, but that the stimulus money is being made available to residents by the federal government, but through the reimbursable program will be indeed delivered to residents? And the second question, because I know the system's a little acting up a little bit today. The second question would be relative to incoming visitors to the territory. You mentioned that the airlines have diminished their service to the territory, but there may still be people coming in. The last time we spoke, I'd asked whether the government could do, or your administration could take any other action other than just advising or urging folks to, pay attention to and obey the 14-day quarantine request. If they are not doing so, and some of those persons might be sick, is there any other action your administration could take to really enforce that, or to make sure that folks are really sheltering in place and paying attention to those orders? Thanks.
I really don't think there's anything I'll answer your last question first. I don't think there's anything that we can do violating a 14-day quarantine. We can just ask them to be in place. I mean, they're still American citizens. They have right. We can't force them into a situation where we lock them up if they don't 14-day quarantine. We can just ask them to comply. The strategy is that if there's nothing to go to, then you don't have any reason to comply. If there's no beach bars to go to, or there are no activities going on, then you will essentially stay home, which is why we close down those non-essential business, to make sure there's nothing going on. This weekend in Christiansted, I drove around. Every day looked like Sunday. It's starting to look like the Walking Dead movie around here these days. There's just lack of activity in our downtown areas particularly. As far as government paychecks, we don't have an issue there. We have 3 paydays in July. That is going to pose a little challenge for us, but the tax filing date is July, so hopefully we'll be getting in that money right around that time in order to offset that. As far as the Virgin Islands is different than most every place else in the U.S. essentially, where we keep our federal taxes. So for the rest of the U.S., the states don't have to worry about the stimulus payment. The federal government is giving them a direct check to their constituents. What we're trying to do is 2 things. On the one side, we have the letter of credit that would allow us to issue $40 million in checks and then be reimbursed by the federal government. That's one approach. But the preferred approach is what we've been working on for a little bit now, is getting Treasury to say, we're going to give you the $40 million up front and allow you to disperse the checks, because other states have their own taxation system. They do not rely on the federal government. So that's our approach for that. At any rate, we're going to try to get out those checks as quickly as possible. This weekend, I directed the head of IRB to collect all the names of people who tax checks would be owed. What they're going to do is look at the people who filed their 2018 taxes and make the distribution based on that, and then we're going to go back to 2017. So if you haven't filed your taxes in 2018 or 2017, I would do so, and quickly, in order that you can be qualified to take part in this this stimulus package from the government. Other questions? Okay, I just want to thank everybody for showing up today once again. Remember, I know it's getting hard in the house. I know it's very boring. I have a 17-year-old that reminds me of it every single second of the day. I know you cooked everything in your house. You've baked all the cakes you can, but try to find something to do around the yard. Do a little planting, take a walk in your neighborhood, but please don't congregate, and try to keep this quarantine, this self-quarantine, as much as possible as we make it through this pandemic. I'm praying for you. I hope you're praying for me too. We'll make it through. God bless you. Have a nice day.